Welcome back to West Texas View.
Before the break, Dr. Anderson and I were talking about some of the things that you need to know in the doctor-parent relationships, and also how important it is to ask questions and to feel really comfortable with that with your doctor and asking questions. But she also mentioned how important the team is, because a doctor is not available 48 after being up for 48 hours working with a pregnant mother about to deliver a baby. So if your time comes to deliver a baby, you may need another doctor, and that's why there is a whole team of doctors that work together, nursing staff, and one of the things you said off camera was how important the nursing team is, and so it's important as a patient to get to know your nurses too.
If you could interview anybody for 9 months, it shouldn't be the doctor, it should be the nurse.
Okay.
And you know,
so look for who has the best nurses.
Yes, absolutely. Because the thing is, the nurse is the one that's there with you in labor. She's the one coming in and checking your cervix a lot of times. She's the one coming in and being with you when you're pushing or when you're delivering. She's the one helping you back in the operating room when there's a problem. I mean, they are at the bedside 24/7 and there, versus a lot of times we have other duties. We're in the operating room, we're taking care of other patients. That nurse just has you and maybe one other patient taking care of them. So it's funny, you don't meet the nurses till you're actually in labor. It should be the other way around. And part of the team too is the residents and the medical students, and they tend to be a lot more on a good way, more thorough than the attending doctors. We've done this for a while. You know, I'm not going to be on the lookout for somebody having a skin cancer. That's not what I do. I'm a gynecologist. I'm an obstetrician. I don't think so much about that sort of thing anymore. But you know what? The residents do. They're just a couple years away from medical school, and so they know, hey, look, that lady has a mole that looks a little bit strange. We should call dermatology while she's here having her baby and get it looked at. So that's the kind of thing that is an asset to having a teaching program. We see a lot of that sort of stuff with the residents, and they're more thorough a lot of times than a private practitioner would be, even myself included. I think there's a lot of advantages.
Because you're focused on one thing, and they're focused on this whole picture.
Absolutely. We are pelvic surgeons, we're obstetricians, and that's what we think about. And so it's very easy after being out for 7 years from my training. I don't need to know about dermatology anymore. I don't really care about that kind of stuff. But the residents have it fresh in their minds, and they tend to read a lot more up-to-date things than doctors that are in private practice do. So it keeps us as attending physicians on our toes too. We have to stay up, state-of-the-art care. We're involved in trials with patients and things like that you wouldn't get the opportunity to have if you were attending a private practice.
And one of the things you mentioned was the fact that the nurses are really the ones that are doing the frontline work, and you come in and catch the baby, essentially.
Absolutely.
And so the interesting thing about that is you've had this relationship with the doctor, then you have the relationship with the nurses that are right there with you when you're going through that very difficult time and scary time for most, especially first mothers. And then you come in at the end and do all the other. So again, your team is the most important, and that's what makes Texas Tech University Health Science Center so special, is that the whole thing is built around this team concept.
Yes, definitely.
And you're sharing with the Rural Health Medicine Center over here that is really looking at people that live out at Sierra Blanca or some of these outlying areas that don't have maybe a doctor or a hospital anywhere close to them, so they have to drive all the way to Odessa to go to the hospitals.
Well, and one of the interesting things that we provide too for the community is the ability to get a second opinion. If a doctor tells you something and you're not agreeing in it, you know, the doctors that are at Tech, we're not reimbursed based on patients. We're reimbursed based on academic activity, scholarly activity, and staffing resident clinics, but nobody watches how many deliveries I do. Nobody watches how many hysterectomies I do. So you better believe when I do a hysterectomy, it's an evidence-based hysterectomy. So we do see sometimes in academics that patients come from private practices where frankly the doctors are reimbursed that way. And some hysterectomies are appropriate, and I have no problem giving a second opinion on that and saying, you know what, I would do the same thing. And go back to your other doctor, they're doing the right thing. So that's another service that we provide that's something people don't think about all the time.
I would have never thought that.
Well, we don't get reimbursed financially the same way that private practices do. And so there's nobody watching my numbers. There's nobody taking care of, you know, oh, I'm going to drive a nicer car next year. It's just we make what we make. We take care of patients, we do a darn good job, and we do the best state-of-the-art medicine that we can at the time. We also have committees that if we do something that's not evidence-based, we meet on a weekly basis, and all of the doctors get in a room together with the trainees, and we talk about, hey, here's something that we don't like that you did, let's talk about how it could have been done better. And so we have a checks and balances system in place, and there's a lot more self-assessment that's happening in an academic practice than what's happening in private practice from my own experience, having been doing that for 7 years.
And so you have a clinic in Odessa, which is where you are headquartered.
Yes.
Then you have a clinic in Midland, and so often you even confer between the clinics. You confer among the clinic doctors, but then sometimes you need maybe someone has a little bit more experience or training over here that has seen more asthma patients or something.
Well, we have a doctor that's specifically, urogyne is her interest, and so that's something that I don't do a lot of that. So I refer all my cases to her, and she gives much better care on that than I would. So there's advantages for sure.
And I want us though to get back to, and especially out here in West Texas where we've got so much pollen and all that, the difference between hereditary diseases and environmental diseases, and what that does to the baby, what that does to the mother, and so on.
One of the misconceptions that people have specifically about breast cancer and a lot of female cancers is that they're all genetic. There really are two types of breast cancer. There's breast cancer that happens to women over 40 and 50, and that's not genetic. That's environmental most of the time. Genetic breast cancers are women that are 30, men that are 20. There are cases where a woman has a breast cancer on one side and then has a completely treated breast cancer, and then 10 years later gets a second breast cancer, a new breast cancer on the other side. Those are genetic breast cancers. And so most of the time when somebody comes and says, I have a genetic family history of breast cancer, 1 in 8 women have breast cancer, and most of it's not genetic. A large part of it, the majority, is not genetic. And so say me having a mother that has breast cancer at 75, way different thing than me saying my younger sister had it. There's a very big difference in the genetics there.
And your antenna goes up as a doctor when you get that history.
By far, yes. And so that's a person I would have the Angelina Jolie conversation with, and I'd say, do you really, if your sister has this problem and she's younger than you, let's sit and talk about this. We've
got lots more to talk about on the hereditary and environmental diseases. We'll be back in just a minute. Great.
Stay tuned. West Texas View will be right back.